Hello and welcome. Today we'll be discussing a unique and sometimes devastating kidney disease known as Chinese herb nephropathy or aristolochic acid nephropathy. Chinese herb nephropathy, now more commonly referred to as aristolochic acid nephropathy, is primarily caused by the ingestion of herbs containing aristolochic acid. This potent toxin is found in plants of the Aristolochia family, which have been mistakenly used in traditional Chinese medicine for various ailments, including weight loss, arthritis, and skin conditions. The misidentification of these herbs, or their deliberate inclusion, has led to widespread kidney damage in affected individuals. The pathophysiology of aristolochic acid nephropathy is complex and involves several key processes. Aristolochic acid is rapidly absorbed and metabolized within the body. Its metabolites, specifically aristolochic acid I and aristolochic acid II, are highly reactive and bind to DNA in renal tubular cells. This DNA damage leads to mutations, cell cycle arrest, and ultimately, cell death. The chronic injury of the kidneys results in interstitial fibrosis, meaning scarring, and tubular atrophy, or shrinkage of the kidney tubules. These changes lead to a progressive decline in kidney function and eventually, kidney failure. Furthermore, aristolochic acid is a known carcinogen and increases the risk of urothelial cancer, cancer of the lining of the urinary tract. Epidemiologically, aristolochic acid nephropathy was first recognized in Belgium in the early 1990s among women who had taken slimming pills containing aristolochic acid. Since then, cases have been reported worldwide, particularly in regions where traditional Chinese medicine is widely practiced. The true prevalence of the disease is difficult to estimate due to underdiagnosis and delayed onset of symptoms. Genetic predisposition may also play a role in the susceptibility and severity of the disease. The signs and symptoms of aristolochic acid nephropathy can be subtle and develop gradually over time. Early symptoms may include fatigue, nausea, and loss of appetite. As kidney function declines, patients may experience edema or swelling in the legs and ankles, as well as high blood pressure. Anemia or low red blood cell count is also common. In the later stages, symptoms of kidney failure such as shortness of breath, confusion, and seizures may appear. A significant percentage of patients will develop urothelial cancer, which may manifest as blood in the urine or flank pain. Diagnosing aristolochic acid nephropathy can be challenging due to its insidious onset and non-specific symptoms. A detailed medical history, including any use of herbal remedies, is crucial. Laboratory tests will reveal elevated creatinine and blood urea nitrogen levels, indicating impaired kidney function. Urinalysis may show proteinuria, or protein in the urine. A kidney biopsy is often necessary to confirm the diagnosis. Histological examination reveals characteristic features of the disease, including interstitial fibrosis, tubular atrophy, and the presence of atypical tubular cells. Furthermore, testing for aristolochic acid, DNA adducts in kidney tissue can provide definitive confirmation. Screening for urothelial cancer is also an important part of the diagnostic workup. While there aren't distinct types of aristolochic acid nephropathy, the disease can be categorized based on its stage of progression. This ranges from early-stage kidney damage with minimal symptoms to end-stage renal disease requiring dialysis or kidney transplantation. The treatment and management of aristolochic acid nephropathy primarily focus on preventing further exposure to aristolochic acid and slowing the progression of kidney disease. The first step is to immediately discontinue the use of any herbal remedies suspected of containing the toxin. Supportive care includes managing blood pressure, controlling edema, and treating anemia. In advanced cases, dialysis or kidney transplantation may be necessary. Regular screening for urothelial cancer is also essential, and prompt treatment of any detected tumors is crucial. The use of corticosteroids and other immunosuppressants have been investigated, but their efficacy remains uncertain. The most effective way to prevent aristolochic acid nephropathy is to avoid the use of herbal remedies, especially those from unregulated sources or those with unknown ingredients. Public education about the potential dangers of aristolochic acid is also essential. Healthcare providers should be vigilant in asking patients about their use of herbal remedies and consider the possibility of aristolochic acid nephropathy in patients with unexplained kidney disease. Regulatory bodies should strengthen the oversight of herbal products to prevent the sale of those containing aristolochic acid. The prognosis of aristolochic acid nephropathy depends on the severity of the kidney damage and the time of diagnosis. Early diagnosis and cessation of aristolochic acid exposure can slow the progression of the disease and improve long-term outcomes. However, many patients will eventually develop end-stage renal disease and require dialysis or kidney transplantation. The risk of urothelial cancer remains elevated even after cessation of exposure. Recent research has focused on developing more sensitive diagnostic tests for early detection of aristolochic acid exposure and on identifying potential therapeutic targets to prevent or reverse kidney damage. Studies are also investigating the role of genetic factors in disease susceptibility and progression,